Sure. The health department numbers are 84 positive cases, 1,145 negative cases, 76 pending, 59 recovered, 1,305 total tested, and 4 deaths. The drive-through testing site has its first confirmed COVID-19 results. So the drive-through numbers are +1, -27, 0 pending. The total tested is 28. The health department received confirmation of 6 new cases today, which are Ector County residents. The health department is currently conducting contact tracing to determine if these cases are related or new cases in the community. The health department has contacted 1,054 through contact tracing and has referred 326 for testing, and 30 have been positive. The health department would like to remind the community to continue taking precautions by recommending frequent hand washing, stay home if you are sick, wearing a mask in public, and please refer to the CDC website for recommendations and guidance. That would be the health in the county's report. Now, something from the Sheriff's Department, they opened today. The Ector County Sheriff's Office is open today from 8 to 5, and fingerprinting will also resume. But the visitation for the detention center will remain closed until we receive notice from the Texas Commission on Jail Standards to resume. So that's what I have.
All right, thank you, Commissioner Shelton. Russell, do you want to go over the EMCH numbers?
Yes, sir. Good afternoon. Medical Center, we have 753 that have been tested. 53 of those have been positive. Currently, we have 3 patients in-house, 3. One of those is on the vent, so we only have 1 on the vent. 689 negatives, and 11 pending, and we do not have any patients under investigation in the hospital today. So right now we have 3 in-house, and I'll kick it over to Kristen.
Thank you, Russell. As far as Medical Center goes, we did have another employee exposure. We had a housekeeper test positive. Her last day to have been in the building was 4/28. She's at home now, and we did investigate to where she's used PPE, and we're gathering a list of any rooms that she cleaned after the fact. They don't go in there during the patient's stay, so we don't have any patients to notify. It will just be other staff that she interacted with. Another update for us is we just want to remind everyone in the community to bring a mask with you when you come to the facility. All of our patients are in mask, all of our staff members are in mask at all times within the building. So we want to make sure that our community brings those if they're coming as a patient or if they're coming to visit. In the event there's someone that doesn't have the ability to get a mask, we do have some here on hand that we can provide if need be. And then just one last thing for me, if you guys would just bear with me for another couple of seconds. As a CNO, this is Nurses Week. It begins on Wednesday, which is May the 6th. And 2020 is the year of the nurse. And I just want to I would just like to say thank you to every nurse in our community for their unwavering devotion to patients, the time they spent caring for people, the many times that they spend crying with and for patients and their family members. I just would really like to say thank you. Without the nurses in our community, we would not be where we are today, whether that be at Medical Center, at a nursing home, at Ormc. We just would not be where we are. So if you know a nurse or you see a nurse this week, give them a smile, a thank you. Don't hug them because of social distancing, but just smile real big at them. So from the CNO at Medical Center to every nurse in our community, working, retired, whatever you may be doing, I thank you. And I'm very proud as a nurse to be your colleague. That's all for me.
Very well said, Kristen. Thank you so much for that. I know all of us are thankful for nurses always, but extremely during this time. So thank you for that. Stacy, do you want to give an update for ORMC numbers?
Yes, thank you, Trevor. ORMC has tested a total of 303 individuals. We now have 14 positive, so that's up 1 from last week, and the first positive we've had for almost 2 weeks now. 288 negative and only 1 pending, still no patients in-house. And before you skip to Dr. Saravan, I just want to echo what Kristen said as well. Certainly, I think our community now recognizes the value of nurses more than they ever have before, and that's no different in the community or here at the hospital. So we're so grateful for everyone's dedication in taking care of the community. So happy Nurses Week to the community nurses. Thank you.
All right, Trevor. So I do have a little bit of information today. Yesterday, the CDC updated their testing priorities again. It wasn't a major change from last time we spoke. There's still the high priority, and then those people identified as high priority as the two subheadings. The high priority are still the same: the hospitalized patients, the healthcare workers, and residents of congregate living situations. The persons identified as high priority by either public health officials or by clinicians, that's the two people that can identify someone. They did add ethnic minority groups and racial groups that are disproportionately affected by COVID-19. And they added African American, Hispanics, Latinos, and some of the Native Indian tribes. So those are part of the, even without symptoms, being identified as a high priority for testing by the clinician or by public health officials. The one other thing I think I want to sort of reinforce today, now this is not a new change. You guys know about the NIH website that has the COVID-19 treatment guidelines. Again, you can Google COVID-19 treatment guidelines, NIH. And that website, if you look under overview, there's two statements that I definitely want to read that have to resonate with the community. The panel, which is the NIH panel of doctors that reviewed all the evidence, does not recommend the use of any agents for post-exposure prophylaxis. Post-exposure prophylaxis means if you think you were exposed to COVID, does not recommend anything. And with regard to treatment, does not recommend any drugs. And that's kind of very important for the community to know about, that there is no proven medications for this disease process as of right now. Even the ones that are under investigation, therapeutic options for COVID-19 currently under investigation, we've talked about so many different medications, right? We've talked about chloroquine, hydroxychloroquine, azithromycin, we've talked about the remdesivir, the antiviral, we've talked about lopinavir, rotenavir, all these different medications. None of them currently have sufficient clinical data to support a recommendation from a panel of scientists and doctors for use. So there's anecdotal evidence and there's some scientific articles that come out supporting this, but this NIH panel is what we would consider a multi-layered peer review, multiple sources, and sort of giving you a recommendation. And there is none with regard to antivirals. There is none with regard to immune-based therapies, host modifiers, all of those kind of medications. Interleukins we've talked about, interferons we've talked about. None of those are currently recommended for treatment. So supportive care is what we're giving to COVID-19 patients. And that's the one thing that they keep saying again and again: personal protective equipment and then supportive care. So that's the only thing I want to make sure the community fully understands.
Thank you, Dr. Servan, and we appreciate that. Before we go to the media, I want to give the mayor a chance to give us any words.
Just have seen everybody out. We need to make sure we're wearing masks. I know, unfortunately, it's been 100 degrees and masks are very hot, but one of the things that concerns me is what's happening in Amarillo. They jumped from about 400 up to over 1,000 cases of COVID-19. And so as we go forward, we just need to make sure you're carrying your sanitizer, hand sanitizer, and wearing a mask, and just be careful and social distance. So.
All right, thank you, Mayor. Looks like first up on the list today, Marcos. Marcos says he does not have any questions. So next up would be Danny.
I have two questions. One for Commissioner Shelton. How successful was this weekend or this Saturday the Texas Air National Guard doing the COVID-19 testing at the Coliseum?
Well, Danny, I've been reaching out for some numbers on that. That was not coordinated through the county. That was the National Guard. So I don't have those numbers yet. but I will certainly report them once I get them.
And my next question is for Mayor Turner. There seems to be some people in the community that are kind of upset that one of the local gyms, a person was already cited for having people inside the gym. What is the message to those gym owners?
Well, I mean, to the gym owners, I respect their right to picket. I respect their right to go on Facebook, put whatever they want. But the governor has given us an order. And if I do not enforce it, I can be sued for writ of mandamus for his failure to execute the governor's orders. So the fire department, the fire inspectors and police are looking for businesses that are open that aren't supposed to be open. And unfortunately, it was his choice to open the business. He had full access to the executive order coming down from the governor. And unfortunately, he chose to go ahead and open it. He has been cited. You know, if you read the executive order, it says failure to comply with any executive order issued during the COVID-19 disaster is an offense punishable by a fine not to exceed $1,000 and confinement in jail for no terms, term not to exceed 180 days. So those are, you know, those are the punishments for going against the executive order of the governor.
So how close are the gym owners ready to open? I mean, how close are we to open those up?
I'm hoping they'll open them up at the next time the governor speaks, which will be next week. But we just have to wait for the governor's orders. He's taken the authority away from us locally to be able to open anything that he says we cannot. We can go stricter, but we cannot be any more lenient than the governor is.
All right, thank you, Mr. Mayor. Thank you, Commissioner Shelton.
And as far as the National Guard that came in, or the State Guard, Dr. Benton, are you there? Do you have an update on that, a little more information?
I'm trying to do this remotely, so I'm actually in the health department today, this afternoon, and they reported to me that there were about 80 tested by the National Guard on Saturday.
Okay, and obviously still waiting on results for those.
That's correct.
Okay, awesome. So about 80. If you couldn't hear Dr. Benton, for everyone, about 80 individuals tested by when the National Guard came in. So thank you for that update. All right, looks like next up is Mitch.
Thanks, Trevor. Commissioner Shelton, I'm just curious, of the new cases announced today, how many of those were staff members from Midland Medical Lodge?
I'm not aware that any of them were from the Midland Medical Lodge.
Okay. And to MCH, I understand that y'all did some testing or ran some tests for Midland Medical Lodge over the weekend. Could you just go into detail on like how that worked and who was actually doing that testing?
We did not do any testing for medical lodge. We got some calls from the state out of El Paso, but we could not meet their time that they were wanting to get that done, and we weren't able to assist in that testing.
Oh, you weren't? Okay.
No, sir.
All right. Just want to clear that up because the city of Midland listed y'all as that. Mayor Turner, how many businesses or citations were cited over the weekend for opening or have that when they weren't supposed to, or for having too many people in their businesses?
I will find out today and I'll have it for you tomorrow.
Perfect. Thank you so much. And to the doctors, I'm curious, you know, I was out in ODESSA and Midland wearing my mask, of course, but I saw a lot of people were not. And I guess, when are you guys like preparing to maybe see an uptick in numbers if that was to happen in ODESSA?
So I guess it would be hard to answer if we would see an uptick or not. That's speculation for now. But yes, less protection means the exposure risk is higher. So the potential to have a spike is possible. So I think the mayor has said this before too, highly recommend wearing masks. So we're not going to enforce it per se, but make a highly recommend statement from medical professional standpoint and from leadership of the city standpoint. So hopefully people will heed that advice and try to maintain that social distancing principle.
So there's not like a day like this weekend, 5 days, or like a week from now when you may be like just watching
Right.
yourself.
If you're looking for a timeline, Mitch, I think the best timeline to count on is the incubation period, which is between 2 days and 14 days, an average of 5. So 5 would be an appropriate number to look at for this last weekend to say, hey, does anything come up, next weekend? But it could be up to 2 weeks afterwards.
All right, thank you. And my last question for Dr. Benton, if he's still here, I can't tell.
I think he is. I think he's going in and out. Yeah, looks like he's still connected though.
Dr. Ben, I'm just curious. I know you said 80 people were tested. Do you know how many tests were available at the Echd County National Guard testing facility? I know in the Big Bend Tri-County area, they had less than the 150 tests that were initially thought that the testing sites would have.
I don't think you can hear us. Yeah.
It's my understanding it was 100.
It was 100? Okay.
It was 100 coming in, but that's just what I remember hearing from somebody.
All right. Well, thank you to Mayor Turner. And those are all my questions. Thanks, Trevor.
All right. Thanks, Mitch.
I have an answer for you on the number of citations that were issued. So the Fire Marshal's Division only issued 1 citation this weekend.
Thanks, Devin.
All right, next up, Mike Merlot, Odessa American.
Hi, yeah, Mayor, I had kind of a similar question, which was how many people have been cited for COVID-19 related incidents like gatherings and things like that? What would that citation be called?
It's a ticket. It's just like a regular ticket.
Okay.
I'm not sure if it's Class B or Class C, but I can find that out for you. But we are encouraging them to warn them first, say, hey, this is something we need to watch. And we don't just go out and write a ticket first. Usually they'll have a couple of warnings. And then if the behavior persists or the business stays open, that's when the ticket can be issued. And so that's what happens.
Okay. Do we have those numbers for since we started ticketing people for those kind of incidents?
No, but I can ask.
Thank you. Appreciate it. And for the county, Eddie, does Mr. Dusler, Sergeant Dusler, have that information for the county, people being cited?
There hadn't been anybody cited as of yet.
Oh, okay. No one else. Okay.
Yeah,
and then,
no issues today.
All right. Appreciate it. And what does contact tracing show for the housekeeper at MCH and I guess other MCH employees? How many people have potentially been exposed, and is that from within the hospital or is that from outside? Do we know that?
We're still working on gathering the list. We had to reach out to that employee as well as her direct leadership to kind of find out which room she had cleaned that day. So they're still going through those logs, but we will definitely have those numbers in the morning for you.
Okay, thanks. And Mayor, you mentioned Amarillo is seeing a jump in cases. I guess, do you have a contingency plan, to have stricter regulations if there's a jump here? And what would, you base that off of to have stricter regulations?
I'd talk to the physicians, to also talk to the health department. I know part of that is tied to the meatpacking industry. Unfortunately, they've had a lot of trouble throughout the U.S. But got a text last week from the mayor and said they had some hot spots that they were really concerned about. And I think the numbers show that she needed to be concerned. So we just hope they start going down for them.
And for here in Odessa, do you have any plan for anything like that? You know,
No,
something.
that was something that got into an industry. You saw the same thing in Abilene. Abilene had it get into a factory.
Right.
Many of them did not speak English very well. I think most of them from the Congo. And I think there was a language problem. They were swapping masks. You know, after the end of the shift, here's my mask, you use it. You know, I think Abilene's problem was partly that. But I would suspect, I haven't talked to Mayor Nelson yet, but I may reach out to her just to check.
Yeah. And as far as, you know, what it would take for, you know, you as the mayor of Odessa to enforce stricter regulations, you know, is that something you've talked about or thought about or with city council or anybody?
We haven't talked about it, but you know, things like if the hospitals were full or if they were overflowing, things like that, it would have to get to that level, in my opinion. But I would talk to the physicians in the health department.
Okay.
So Michael, you know, one of the most important things that the health department needs to do in these times is be able to contact trace very, very quickly. It's untraced clusters that cause a significant rise. If you look at all the different cities that have reopened, or even the cities that didn't have good contact tracing before, it's the untraced clusters that will cause increased spikes. So if our health department can stay on top of contact tracing, as soon as that first positive comes out, or a small cluster of positives come out, to be able to contain them quickly, isolate, and then counsel everybody that was exposed and isolate them, that would be the most important thing to work on. Our health department now is completely current on contact tracing. They've made, you know, thousands of phone call touches and monitored people over time. So for now, and I don't know the exact number of contact tracers they have, but they have a bunch. They have case investigators, they have contact tracers, they all sit in a big room together, they all discuss back and forth. So if they get that first notification and they can quickly start that contact tracing process, they'll be able to contain it very quickly.
Okay. Thank you, Dr. Saravan. Appreciate it. That's all I have.